Gary Kremser is retired, so that means he spends more time doing the things he loves.
I enjoy hunting, fishing, walking on the beach, playing with my grandchildren, and just being actively busy most all the time.
Those activities became increasingly difficult after Gary developed a hernia after an emergency appendectomy.
Anytime you make a cut or put an incision on somebody's abdominal wall, they can develop a hernia, which is really just it's a gap in the muscles and the connective tissue of the abdominal wall.
I started with a small umbilical hernia that spread over to my left side, probably 2 or 3 inches, and it became even more, I wouldn't call it disabling, but more and more uncomfortable and painful.
The hernia began to impact Gary's life.
I was unable to lift much more than 20 pounds without, I would say, significant tenderness in my left lower quadrant and my belly button area. To climb a tree stand or to go out in the waves and enjoy the beach like I really routinely would do, gave me a lower or not as nice a quality of life as what I was used to.
When I could start to see the hernia protruding from his shirt, I mean, you could see that it was actually there through his clothing, then I knew he needed to get something done with it.
Gary's family doctor recommended reaching out to Dr. Pauli at Penn State Health.
I had a CAT scan prior to seeing him or shortly after, and he reviewed my CAT scan and he told me exactly what I had. He gave me options of what he could do.
What we suggested was a surgical repair, and for most people who have hernias related to an incision, we typically discuss utilizing a mesh-based repair to manage it. We use mesh because it helps reinforce the abdominal wall, especially in areas that are weakened.
He said he could open me up and do surgery that way, or do surgery with just 4 little puncture holes and have him do some of it and have his robot do the rest of it.
So the operation that we offered him is a new type of hernia surgery that's called ETEP. That stands for Extended Total Extraperitoneal. Instead of going inside the abdominal cavity with our laparoscopic tools, we essentially work only inside the layers of the abdominal wall. We never really even view the organs inside. We create a pocket behind the 6-pack muscles on the right and the left-hand side, and then connect those 2 pockets together in the middle.
I liked his idea, and he obviously was very confident that he could fix me. I was very comfortable with his confidence. I've been around the medical field a long time, and I was just really confident that he was the guy I wanted to go to and take care of my hernias.
Gary spent a night in the hospital. Initially, he had some restrictions, but he recovered quickly.
I think by the way they chose to do the surgery where they didn't actually open him, it made his recovery so much quicker, so much smoother, and I think Dr. Pauli did a great job.
By approximately 6 to 8 weeks, I was able to do essentially anything I wanted to do with minimal to no symptoms. And after the 8-week period, I've pretty much had no symptoms at all.
Oh, I think he's doing great. Nothing seems to bother him. I mean, he just kind of does everything he has to do. He has no pain whatsoever in lifting.
So it certainly has made a difference in your life.
It's restored my quality of life back to where it was prior to me having to have hernia surgery. Yes, ma'am, it certainly did.